So I want as many vulnerable Americans who don't already have immunity to be immune with a vaccine, because immunity downgrades the infection. It doesn't eliminate it. It downgrades the effect to make it a more manageable illness, and it reduces hospitalization and transmission. Now, what's going to be the most effective way to get people vaccinated? Is it a politician doing a television advertisement, or a local physician making the case that we had a patient who came in with no immunity, got very ill, went on a ventilator, and just before intubation asked for the vaccine, and unfortunately had to be told it has no benefit at that point? The power of testimonials, local medical officials, and the context of that relationship is, I think, the most powerful vehicle to get those at risk immune. If you look at the mandate, it does represent to some people the excessive hand of government, and therefore they become hardened to the idea, and it alienates people. We see people who are a hard no simply because they believe the government shouldn't be able to do this. Well, that's unfortunate, because we might have otherwise convinced those people to get vaccinated. And let's be honest, the mandate does represent a broken promise by every single public health official and elected official in power today. All of them had said, we are not going to do mandates when the vaccine was rolled out. So if you're a patient out there, you're an everyday American and somebody vulnerable that we want to get vaccinated, they have a right to be angry right now. This does represent a broken promise. That idea, by the way, of a mandate was introduced, if actually you remember the day it was introduced to the public, it was in a New York Times op-ed by Dr. Zeke Emanuel, and it came out the day that J&J was pulled off the shelf in an emergency move because of the fears of the risks of the vaccine. We almost sort of forgot where the origin of where that mandate came from. So for a lot of people, you know, they have a right to be frustrated right now. They've lost trust in public health, and that's going to hurt us beyond COVID. Final point is, I would love to see the same enthusiasm for these mandates for therapeutics. We have some state-of-the-art therapeutics that no one may be a silver bullet, but in combination are pretty impressive. Even if you avoid the therapeutics where there's controversy, there's solid randomized controlled trials supporting several safe therapeutics, as simple as a hypertonic saline spray and mouthwash, and Prozac or fluvoxamine, for which there's solid evidence, and Merck's new drug, which is now authorized and in use in the UK, molnupiravir, cut COVID deaths to 0. No one who's gotten the drug has ever died, and that's in the formal randomized controlled phase 3 trial. All of those therapeutics in combination, so no one should be dying of COVID right now. No one should be dying of COVID. So that is, I wish we saw the same enthusiasm for therapeutics as we are for the mandates.
Thanks for watching the Heritage Foundation's YouTube channel. With more than 500,000 members, we are the nation's largest conservative research and education institution. We believe the principles and ideas of the American founding are worth conserving and renewing. Please help us further our mission by subscribing to this channel and sharing our videos with your family and friends.